questions, and we will try to have one question per journalist. So we will start with Sputnik, and we have Valentina online.
Hi, thank you very much for taking my question. Do you hear me?
We hear you very well.
Thank you very much. I would like to ask WHO's position on an announcement made by the South Korean authorities that the country is experiencing now a second wave of the novel coronavirus infections in Seoul. Are there indeed indications of a second wave rather than a second peak within the first wave there? And should other countries, which were like South Korea, among those hit by the pandemic first, anticipate a second wave as well anytime soon? Thank you very much.
So thank you for the question. I can start. So yes, I mean, there are many countries right now that which have had success in suppressing transmission and bringing human-to-human transmission down to a low level that are starting to see increase in cases. And there's a number of reasons for that. They've either seen outbreaks in certain settings or closed settings, like we've seen related to either religious events or related to outbreaks in dormitories of expatriate workers or in different types of facilities. Whether that's a second wave, you've heard us speak about this before, where any opportunity that the virus has to take hold, it will. And it's really important that countries are in a position to be able to rapidly detect these cases and put everything they can to isolate cases so that the outbreaks don't become larger, and that these small numbers of cases don't become clusters, and that these clusters of cases don't become community transmission again. Korea has a lot of experience in dealing with COVID, like all countries do now, and in particular when they see outbreaks that are occurring in specific settings and they know what to do. And so we urge all countries to be at the ready to be able to detect any cases that pop up, regardless of where they may be. We know that there are particular vulnerable settings, primarily where there may be patients, so in healthcare facilities, whether you have closed settings where people are in close contact with one another, and be really ready to find those cases, isolate cases, carry out comprehensive contact tracing, and care for those individuals who need care in medical facilities.
And if I can supplement, certainly I'm not aware of an announcement by the Korean authorities on the subject that you mentioned, but I can note that there's only been a 3% overall increase in cases in Korea in the last week, and in fact I think only 3 deaths reported in the last week. But what is clear is there have been new clusters in multiple settings in Seoul. And the overall number of cases actually in South Korea is very, very stable, or actually dropping. These new clusters, obviously, they're linked to various settings, to clubs, to shelters, to amusement parks, and to particular settings in which transmission has been diagnosed. My understanding is that the vast majority of cases being detected are linked to existing and recognised clusters, and as such the South Korean authorities still have great visibility over where the virus is and the dynamics and the chains within which the virus is transmitting. But that's a constant struggle to stay ahead of the virus. So continued vigilance is extremely important. I know the Korea Centre for Disease Control and the government in the Republic of Korea are hugely skilled now in detecting clusters and investigating clusters, and in doing the kind of targeted measures that allow them to bring these clusters under control. But it is a challenge for all countries, and I think South Korea with other countries demonstrate that even when you get down to very low incidence, you still have to have a very strong public health surveillance system, and you still have to have a very capable public health infrastructure. You still have to have a population that is willing to take the necessary actions. And I think what we see in the Republic of Korea is a highly engaged community that believes in science, believes in its authorities, and is willing to implement measures at a subnational level that are aimed at reducing transmission. So from that perspective, I would say that Korea is still on track with its disease control efforts, but like all countries, there are always risks of any disease getting out of control.
Many thanks. Next question comes from Juan Miguel Hernandez from El País. Juan, can you please unmute yourself?
Aló.
Hello?
Hola, ¿me oye?
Yes.
Quisiera preguntar sobre denuncias de los últimos días de personas en España que han dicho que tienen síntomas de coronavirus persistentes, tos, fiebre, dificultad para respirar durante los últimos 3 meses. ¿Cuál es la investigación o la percepción de la OMS en ese caso?
Thank you for this question. Yes, we're working through our clinical network and with clinicians who are dealing with patients infected with COVID-19 to understand not only how the patients are dealing with disease and what kind of disease they experience while in hospital, but after they recover and when they are released from hospital and they go home. We have guidelines around rehabilitation and follow-up of those who do recover. And we should say that we are seeing millions of people who are recovering from COVID-19, which is a very good sign. But indeed, there are people who have persistent, some people who have persistent symptoms, like a long-term cough, like a dry cough for some time. They may feel quite fatigued for some time. It may feel some shortness of breath while they're climbing stairs. But we are working to better understand what recovery looks like, and more specifically and more importantly, what type of long-term care, if needed, what does that look like for people who have recovered? We do know people who have more severe infection, who've perhaps been intubated, may have some damage to their lungs, and that may take a longer time to recover. But again, we're still learning about this disease. We're still learning about how people recover and what care they need after they are discharged from hospital.
Thank you. Next question coming from AFP, Nina Larsson. Hello, Nina.
Hello, hi, can you hear me?
Very well.
Okay, thank you for taking my question. I wanted to ask, following the release of data from a National Health Institute study of wastewater in Italy last week, suggesting that the novel coronavirus was present in 2 large Italian cities in December. I was wondering if WHO is still confident that the virus source is in China, or if you're aware of other wastewater studies showing similar results that might raise questions about the understanding of when and where this pandemic actually began. Thank you.
And this is the Italian findings. I think are very interesting. I don't believe that live virus was cultured, but I do believe it was related to RNA fragments. And it is always important that if RNA fragments are recovered from water that was collected in December, then clearly there is a chance that this virus was circulating in northern Italy, obviously before anyone had realized that it had been. Having said that, the documented importation of cases, which temporarily, from a timing point of view, led to the explosion of cases, what's not clear is to what extent the presence of the virus or the potential presence of the virus in the environment before the known importation, in what way did that contribute to the amplification of disease at community level? So it's very important that these results are further pursued. I know there have been other wastewater or water-based studies. Maria may give you more details on those studies. But it is important. These are important findings, and it's very important that they're pursued. I don't think at this point it changes the hypothesis on disease origin per se, but we must remain open to any scientific findings that offer us clues as to the potential emergence and amplification of this disease in human populations. Maria?
Yeah, only to very briefly add that the use of looking for the virus in wastewater, and as Mike has pointed out, this is looking for fragments of the virus, so RNA fragments of the virus, not live virus has not been isolated from wastewater. What we're looking at is in the context of surveillance for COVID-19, we know primarily we need to focus on looking for people who are infected with the virus, actively infected with the virus, because this is important for making sure that they have the right clinical care and that we follow their contacts, and so we could break chains of transmission. But in addition to that, we're looking at other ways, potential ways in which we can look to see if the virus is circulating. We've mentioned looking at the influenza-like illness and the severe acute respiratory illness, respiratory disease surveillance that exists in most countries to see if it's circulating in the community. Wastewater is another potential way in which we can look to see if the virus may be there. But again, that won't help you find individuals who are infected with this virus, which is so critical at looking at suppressing transmission, so finding those individuals. So that is something that is in our overall surveillance portfolio for COVID. And we hope that this will be helpful in determining where the virus may be present, where it may be more difficult to find individual patients. But it is critical that our surveillance efforts, most of our surveillance efforts, are focusing on finding individuals who are actively infected with COVID.
Thanks. Next question, N1 TV from Bosnia-Herzegovina. We have Esmir online. Esmir?
Hi, can you hear me?
Yes.
My question is regarding region of the Western Balkans. Are you afraid that we are going to have increased the number of cases? Because yesterday in Croatia we have a tennis tournament in Zadar with quite few players and officials infected with COVID-19. Also in Serbia, yesterday we had parliamentary elections with almost 3.5 million people voting. Bosnia has number of cases reporting over the last 24 hours increased. And also in Montenegro, we have religious processions. And in all those cases, we haven't seen many masks and protections. Are we on the road to have more and more cases reported? Thank you.
From the perspective of the Western Balkans and also countries further to the south, certainly they have been in the main less affected than other countries in the European region early on in the epidemic. And some have been very successful in ensuring that the disease numbers have been kept low. But as we've said, in other countries in Asia, they've managed to get their numbers very low, and in countries that still have low numbers, there is always the chance of disease amplification, particularly in association with mass gatherings. We've seen that in some of the outbreaks in Europe and in other places where amplification events can occur, super spreading events can occur, and disease can explode very quickly. We've seen super spreading events in any number of different settings, mainly in closed indoor settings, both occupational, residential, and other settings. So there are always risks, and it's really important that the gains that have been made by countries in the Balkans that have avoided the worst of this disease, that they continue to sustain those efforts. And it is very important that the same measures are applied, that people are aware and are applying hygiene measures, that physical distance is being respected even in the situations of low incidence, that people are wearing masks in the appropriate settings, and that organisers of mass gatherings are aware and managing the risks associated with those gatherings. All countries have specific recommendations related to the gatherings, the size of gatherings that can occur, and how those should occur and how risks should be managed. I can't specify for any individual country what those are, but organisers of gatherings, whatever those gatherings may be, should respect the advice of national authorities and try as best as possible to implement those. The measures that are being advised are very simple, they're very practical, and it's incumbent on all to apply them. And we do hope that the countries in the area that have had a great deal of success in keeping the numbers low will continue to do so if those measures are applied in a systematic way.
Next question is for Sarah Newey from Telegraph. Sarah?
Hi there, can you hear me?
Yes.
Brilliant. There's been reports that today that Africa is nearing 300,000 cases. I just wondered, how much do you think that's an underestimate? And do you think that Africa could be the next hotspot? We've seen it's obviously focused in Latin America and North America at the moment, but are you concerned that might shift in the coming months?
Here, yeah, that on it is okay. Yeah, I think the situation in Africa is mixed, and I think Africa is a very large continent, both in the sub-Saharan sense and North Africa, which are in two different WHO regions. But we've seen increases of disease in some countries in excess of 50% in the last week, and we've seen other countries with very, very stable numbers. But in general, the numbers are on the rise. In Africa, we've seen large increases in places like South Africa. We've seen increases in places like Benin, in Eritrea, in Ethiopia, in Burundi. What we haven't seen yet are large increases in the number of deaths. So Africa, at this point, is still avoiding the large proportion of deaths that have been associated with this disease in other continents. Now, there are important caveats here. Testing is not as frequent in Africa, so there clearly could be underreporting of cases. Hospitals do not appear in most countries to be overwhelmed. In certain countries, like in Nigeria and in heavily populated areas like Lagos, hospitals have come under significant pressure. So I would say the situation in Africa in general is very mixed. It very much depends on the context in which people are living. Larger cities seem to be more affected. We've seen outbreaks in refugee camps. We've seen, as I said, increases in cases in a number of different settings. Will Africa be the next epicenter for this pandemic? I certainly hope not, because the health systems in Africa in general are weaker than in other parts of the world. Populations, while they have the benefit of an age profile that's much younger, there are many people with underlying conditions. There are many, many vulnerable people. And we need to try and keep these numbers as low as possible, while at the same time making sure that the lives and livelihoods are protected. And this is a constant challenge. So there is no room for complacency on the African continent. This is a time to really focus in on improving surveillance, really focus in on improving the capacity of healthcare to treat cases, and to focus in on some of those countries that are experiencing quite large increases of cases. And our African Regional Office, our Eastern Mediterranean Office, continue to work with those countries. And we have WHO offices in all of the countries in Africa, and will continue to work closely with governments there, both transmission and to reduce case fatality where that is a problem.
We will have now China Daily. We have Chen with us.
Hello. Hi. I just have a question. Forgive me if you have already published such a guideline. Countries who have actually reopened lately, I mean, like Europe or some other places, people started traveling. So has WHO published the guidelines on travel industry? I mean, how, like, whether car rentals or hotels could be safe? I mean, wouldn't it become a super spread? Thank you.
I can start, and maybe Mike would like to supplement. Yes, I mean, we are working very closely with the travel and tourism industry to support them in the process of opening up and the process of having travel that's safe, and making sure that we reduce the risk of transmission within facilities related to travel. So we do have a series of documents out on guidance around hotels. We're working with the airline industry to look at the safe resumption of flights, and we will have more guidance coming out in the coming days on this to be able to support the safe reopening. But it is important that while people travel through the whole process of travel, leaving their home to where they reach their destination, that is done in a safe manner. And not only is it important for the industry and the airlines and the hotels to be able to offer safe experiences, we need individuals to also play their role. And for example, the DG highlighted this in his speech today. It's important that everyone at an individual level know what they can do to protect themselves, to protect their families, to protect their communities, from infection and from onward transmission. And this includes the basics. It includes all of the basics of physical distancing of at least 1 meter, making sure you practice respiratory etiquette, that you wear a mask when you need to wear a mask in situations where you can't do physical distancing and where there's transmission, making sure that you practice hand hygiene. All of these things need to be practiced globally as we move forward, as this pandemic evolves.
And as Maria said, we will be issuing further guidance in the coming days as countries open up to travel between each other. But again, I think it's important to emphasise that it's the responsibility and duty of each sovereign state to put in place the protections for its own population, and that applies not only within countries but with regard to travel into and out of any given country. And we do recognise that countries exist at states of different risks. Countries who have very, very low incidence of disease or no incidence of disease may design measures that may appear stricter than in other countries, because the risks to them of importation of disease and the consequence of that importation are much, much higher. So WHO has been clear of disease may design measures that may appear stricter than in other countries, because the risks to them of importation of disease and the consequence of that importation are much, much higher. So WHO has been clear facilitation of travel, and measures that result in any restriction of travel should be based on public health protection, on public health principles. They should be measured, they should be reviewed regularly. But in the end, countries are in a position to measure and manage the risk to their citizens, to their society and to their economy. And as such, as we open up and as we travel between countries, it's really important for member states and others to put in place those measures that they feel are commensurate and are balanced, that protect their populations, while at the same time, as we've seen, balancing risk of disease against lives and livelihoods. Within countries we see this dilemma. How do we manage lockdowns and how do we manage stay-at-home orders while at the same time protecting lives and livelihoods? That same factor comes into play when you talk about international travel and international trade. You're trying to balance public health risks against lives, livelihoods, economy. And it's not an easy challenge for any government. It is a dilemma. It involves trade-offs. There are no zero risks. And as such, we will support member states in making their risk assessments, in coming to measured judgments regarding the risks to themselves and the measures they need to put in place. But ultimately, we would like to see public health-based measures that are reviewed regularly, and that we all move towards a new normal that involves us being able to move around and being able to travel and trade in a normal fashion, while at the same time managing those public health risks. And we will be issuing more specific guidance in the coming days around that process.
Now we will have Lara Pinheiro from Globo, Brazil. Lara?
Hello, can you hear me?
Yes, please go ahead.
Hi, good afternoon. Thank you for taking my question. I would like to know what the role is of Ivermectin, if there's any, in fighting COVID-19. What do we know so far?
I think we had this question some time ago. We'll have to get back to you on the details. I mean, there are many, many molecules and older drugs that have been tested as either prophylaxis or as treatment. We'll have to get back to you on whether or not there are any ongoing trials using ivermectin. We'll probably get back to you before the end of the press conference. We just need to check that we give you the right information.
Lara, stay in touch. We will provide that. We will now hear from Reid Wilson from The Hill. Reid.
Sorry about that. Can you comment on the rising number of cases in the United States, particularly in southern states? What do you make of the rise in both positivity rates and cases among younger people?
I think there's been upticks in cases in a number of states in the US. I'm not 100% sure about the age profile, but I've seen the reports that some of this is amongst younger people. That may reflect the fact that younger people are more mobile and are getting out and taking advantage of the reduction in the restrictions of movement. And this is something that WHO has spoken about many times. Many countries have experienced clusters of disease or upticks in the aftermath of reducing stay-at-home orders or allowing population mobility to happen. What we've said, and I believe the scientists in the US are saying this over and over, is that maintaining vigilance around physical distance, personal hygiene, the wearing of masks according to the national guidelines, and where appropriate, the increase of surveillance so that clusters are investigated, testing, tracking, isolating cases, quarantining contacts. This is what needs to continue. And I believe that is happening in many countries and in many states in the United States. So I think it's for at the federal level, I'm sure our colleagues there are looking at this and what the implications of this are, state by state. Each state is unique, and I'm sure each state is looking at the implications of this for their population. What is clear is that the increase is not entirely explained through just increased testing. There's some evidence of increasing hospitalizations, but this was always a possibility when restrictions are lifted, and again has happened in many countries. The issue is not the rising numbers per se. The issue is what is to be done to bring those numbers back, and what combination of measures can be used in order to do that, in terms of targeted public health measures, increasing surveillance, increasing cluster investigation, and ensuring that we identify cases and contacts as quickly as possible, isolate the cases, quarantine the contacts, and where necessary, and hopefully at a much more localized level, there may be a need to put some restrictions in place in order to suppress infection. And again, we've seen countries do that at a micro level, not at a state level or even at a national level, but to where needed. If there are clusters of cases with potential for community transmission, that there may need to be some adapted measures to suppress infection while the clusters are investigated. Yeah.
We will now go to Carlo Martuscelli, if I pronounce well, from Politico. Carlo, can you hear us?
Yes, can you hear me?
Yes.
Yes, thank you for taking my question. This is regarding the outbreak in Germany at the meat packaging plant. I wanted to know if you were monitoring that outbreak, and if you could just provide any guidance as to which particular workplace locations we're seeing might be more vulnerable for starting these outbreaks and potentially for giving more momentum to a future second wave. Thank you very much.
Thank you for the question. Yes, indeed, we are following this outbreak in this meatpacking plant in Germany, as well as a number of outbreaks and clusters that are happening in food processing plants across a number of countries. What I can say is that we need to know more. to really better understand why these clusters are happening, why these outbreaks are happening, so that we can learn how to stop them. There may be some I don't want to speculate too much because we need to learn more about these, and the outbreak investigations need to be carried out to better understand what's happening at the factories, the plants themselves, as well as the individuals who are infected, the living conditions in which they live, and any other potential sources of infection for these outbreaks. So we are working with a number of countries, a number of groups to better understand and consolidate our understanding.
Now we will go to Bayram Altug from Anadolu Agency. Bayram?
Hi, can you hear me?
Yes.
Thank you very much for taking my question. Good afternoon, all of the people there. My question is also related to Italy. Professor Alberto Zangrillo, head of intensive care at Italy's San Raffaele Hospital in Lombardy, has said that the new coronavirus is losing its potency and has become much less lethal. He said that COVID-19 mutates over time and hopefully one day will become a common cold virus. It can also be noted that while the number of cases broke a record in recent days, there is no serious increase in the number of deaths. In the light of this data, do you think the virus is really loses its effect? Thank you.
I will begin. So thank you for this. Thank you for this question. We've mentioned before that there's a large number of virologists and scientists that are looking at this virus as it emerges in all countries. And I just checked today, and I saw there's more than 49,000 full genome sequences that are available that we're looking at to determine if there are changes in the virus. And as this is an RNA virus, there are changes, expected changes in them, and we're trying to determine if those changes have any impact on the way that this virus behaves. We haven't seen that yet, but we have a group of people globally who are looking at this to make sure that we are paying attention, to make sure that all of the viruses that are shared, and we're grateful for countries for sharing these sequences, determine if any of those changes will mean a different change in behavior. In terms of the potency of the virus, it's an important observation that you mentioned, and we will look into it. But we should highlight that this virus is very deadly. When it does have a chance to infect people, it can kill people. And so we want to make sure that everyone treats this virus seriously and make sure that we do everything that we can from preventing infection, and then from those that are infected to prevent those individuals from developing more severe disease.
Yeah, if I just might add, thus far at least, there is no evidence that of all of the sequences that have been generated and all of the different infections in the world that we're seeing any strain of the virus emerge that has either greater or lesser lethality or clinical impact. In fact, the virus, most mutations in viruses provide no biologic advantage to the virus, and in fact most are detrimental to the virus. But in some cases, just now and again, this is the process of evolution for all DNA and RNA-based organisms. Just now and again, a single mutation or a few mutations can result in the virus changing. And what we're always watching out for is any change that changes the clinical impact of the disease, makes it less or more virulent, but also changes that might reduce the effectiveness of therapeutics or vaccines, or that might affect transmissibility or likelihood of transmission or the route of transmission. Or, in this case too, changes to the virus can reduce the effectiveness of our testing, because our tests are based on recognizing very often the genetic sequence of the virus. So we constantly monitoring the genetic sequences, because it can affect diagnosis, it can affect treatment, it can affect vaccines, and it can affect the clinical impact of the disease and the patterns of spread. So because of that, we maintain very strong vigilance with the network of virologists and others around the world. In fact, I think within the laboratory working group there is, Maria and the team have put together a very specific group of virologists and genetic experts who are constantly reviewing the sequences and looking out for exactly those signals that you mentioned. But with regard to the real-world observations, we are not observing a significant difference in behaviour of this virus in any of the areas that I mentioned, either in terms of its transmission, its clinical lethality, in our diagnostic capacities, nor in the impact of therapeutics.
Thank you, Dr. Ryan. We will now take a question from Sophie from South African Broadcaster. Sophie. Sophie, can you unmute yourself, please?
Is around yesterday, the announcement that the WHO recorded a highest number yesterday around the world. I just want to find out, if you were to attribute this to something, what would be the reason for these high numbers that were reported yesterday? And also perhaps which countries contributed to this high number?
I can begin. The DG or Maria may wish to add. Certainly the numbers are increasing because the epidemic is developing in a number of populous countries at the same time and across the whole world. So from that perspective, a large number of countries are contributing to that overall increase. Some of that increase may be attributed to increased testing. Countries are testing more, and certainly countries like India are testing more. But we do not believe that this is a testing phenomenon. Clearly, when you look at hospital admissions are also rising in a number of countries, deaths are also rising, and they're not due to increased testing per se. So there definitely is a shift in the sense that the virus is now very well established at a global level. It has reached some of the most populous countries in the world, some of the most populated areas of the world, and because the epidemic is now peaking or moving towards a peak in a number of large countries at the same time, you're seeing that impact on the number of cases. Now, in Europe, in Western Europe, you're seeing the curves decrease. In Southeast Asia, you're seeing the curves decrease, and then the overall numbers increase, which clearly means the Americas are contributing, South Asia is contributing very much, but also there are countries in the Middle East and there are countries in Africa that are also contributing to that overall increase. So the situation is definitely accelerating in a number of countries with larger populations, and that is most certainly contributing to this overall increased number. Maria?
Yeah, only to add, if you want some specifics on the case reports every day, we do have a dashboard that's online where you can look and see the actual numbers of cases and deaths that are reported, and you can break that down by countries. So you can get by regions and by countries. So that can give you some granularity if you want to see where are those actual numbers coming from. And it's on our main WHO website.
Okay, we have time for a couple of more questions. Ana Pinto from Folha de Sao Paulo. Ana?
Yes, thank you, Tariq. Dr. Ryan, last week you said there were signs that COVID was stabilizing in Brazil. I would like to ask if you could elaborate a little more on which are those signs and what the trend is now, if the signs are still pointing to stabilization in Brazil. Thank you very much.
Well, I think, as you know, Brazil has surpassed 1 million cases and just reported a record, I think, 54,000 cases in our last 24-hour reporting period. Some of that may reflect changes in reporting, as there was a lag and the change in the systems reporting, I believe, from the state level. So some of that is potentially architectural. But if you look at the number of cases over the month of June, they've remained relatively stable. What you see is a kind of a stable weekly pattern, a decrease at the weekends. And it's not that the disease decreases, reporting changes, but there certainly has been a spike in cases in the last 24 hours. And again, we're looking into how much of of that is artifactual or related to reporting and how many days that reflects going back over the last week. Because on Wednesday, Thursday of last week, the number of confirmations from Brazil was actually below average. And now we have a very much an increased number, which may reflect it's above average. So we're looking into that with our colleagues at the Pan American Health Organization, our regional office for the Americas. The states with the highest number of cases are still Sao Paulo, Rio de Janeiro, Sierra, Para, and Maranhão. And the number of cases at Sao Paulo are approaching 212 million, or 212,000. I'm sorry, but there still is relatively low tests per population, and the positivity rates for testing are still quite high. If you look overall in epidemiologic week 17, I believe the positivity rate was 31% for Brazil. So that generally means that there are probably more cases out there than are being reported. What we tend to see is that positivity rate dropping, usually down to 5% or less in countries that are detecting all of their cases and that are in effect over testing. So from that perspective, we would say that this trend or these large number of cases are not reflective of exhaustive testing, but as I said, probably underestimate the actual numbers of cases. So while the overall pattern of disease in Brazil, as I said last week, is overall flat, the number in the last 24 hours needs to be examined carefully, but also we need to look at the fact that, as I said, up to nearly 1/3 of all tests are positive, which does indicate that there is under-detection or under-reporting of cases overall.
If I could just add to that, it's not specifically about Brazil, but when we look at any case numbers in any country, it's really important that we break this down to the lowest administrative level as we can. The virus doesn't take hold evenly across all countries. There may be differences in intensity of transmission by a state or a province, but then even more importantly, it's to break that down even further. Where is transmission happening? Is it happening in healthcare facilities? Is it happening in these expat dormitories that I mentioned previously? Is it related to specific events? Is it in certain vulnerable populations like long-term living facilities? We need to break down the cases to an understanding so that we know how to tackle it. And when we look at the national level, it's very important to have that national number, and Mike has outlined some of the reasons we may see some differences, but we need to break it down and understand where transmission is occurring, because this will help us control it. You've heard us talk before about these 4 C's, where we go from no cases to sporadic cases, clusters of cases, and community transmission. And what we're aiming to do with the testing and isolating and caring for cases and contact tracing is to bring transmission down from community transmission to clusters. And once we understand where those clusters out, to bring those under control and move that back down. And so as much as we can, and this may be very difficult, especially in countries that are experiencing community transmission, is to really break down our understanding to the lowest administrative level as we can, and use our resources where they need to be used most intensely based on that epidemiology.
And if I could add, Tarek, because I answered the question directly in relation to Brazil. I don't want anyone to get an impression that I've singled out Brazil. If we look at Latin America in general, Brazil, if you count those numbers, the increase in numbers reported yesterday has about a 25% increase overall in the week. But if we look around the region, Chile has had a 41% increase in cases in the same time. Argentina has a 38% increase, Colombia 35% increase, Panama 26%, Bolivia 33%, Guatemala 39%, Honduras 38%, French Guiana 86%, Costa Rica 28%, El Salvador 24%, Haiti 26%, and Venezuela 25%. So what we're seeing is still in Latin America is an evolving epidemic in the region that's affecting all countries, and certainly Brazil, as the most populous country, is deeply affected, but it's amongst many others. And we've also seen worrying increases in death deaths in the same period in some of those countries. So from that perspective, I think it's important to see Brazil in its regional and in the global context. Just to be sure that people don't misinterpret that in responding to a question specifically on Brazil, that we're not conscious of the regional or global context and the place that Brazil sits within that.
Many thanks. We will take our last question for today. We have Pian from NPR. Pian?
Hi, thanks for taking my question. There are reports of minks being culled on a farm in Amsterdam over concerns that they could be an animal reservoir for the coronavirus. So I wanted to ask, what do we know now about animals and humans transmitting the virus between them, and how does that inform our approach to suppressing the virus?
So thanks for the question. Yes, well, we have a team that's working on looking at the animal-human interface and looking at the susceptibility of animals to this virus. You know about the work related to the origin of the virus. What I'm going to mention is specifically about the minks that you mentioned, and indeed there are some minks that have been found positive in the Netherlands and in Denmark. And what we understand from these investigations that are currently ongoing is that they were individuals who infected the minks, so people who infected the minks, and in turn, some of these minks infected some people. It's very limited in terms of the transmission that is happening between the people and the minks, and some of those minks have been killed. We are learning about what this actually means in terms of transmission and what role they may play. I should put this in context that this is a virus that is predominantly transmitting between people through respiratory droplets, and this is the driver of transmission. This gives us some clues about which animals may be susceptible to infection. And this will help us as we learn more about the potential animal reservoir of the COVID-19, of the SARS-CoV-2 virus. There's a number of studies that are ongoing looking at the animals that are susceptible, from minks to ferrets to cats, dogs, pigs, and so there's a large group of scientists that are trying to better understand the role this virus plays. But again, just want to put it into context of the fact that this is a human-to-human transmission primarily that we're seeing, and why we're seeing this virus spread globally.
Thank you, Dr. Van Kerkhove. We will conclude our press briefing with this last question, and remind you that we will get the audio file to you shortly, with the transcript being posted tomorrow. I wish everyone a very nice evening.
Thank you. Thank you, Tariq.